The surgeons here at Midwest Orthopaedics at Rush have actually been among the pioneers of developing the techniques and technologies for cervical disc replacement. Many of our specialists were intimately involved in the clinical trials that led to FDA approval of the implant device, and our research continues year after year as the technology evolves. Our familiarity and over a decade of experience with the procedure enables our surgeons to confidently diagnose each patient's condition and choose the best implant for their unique spinal anatomy. With the right implant and the best surgical techniques, our patients know they can expect the best outcomes. And thanks to advancement in patient recovery, patients can also expect a streamlined experience that's minimally disruptive to their life. In fact, most of our disc replacement procedures are performed in an outpatient setting, meaning you can return home hours after surgery with minimal pain. In both our clinical research and everyday patient population, the success stories have been nothing short of remarkable.